The homes that you bring, the dreams that you share, the pleasure you get when you know that we care. The faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we at USV, you before we at USV.
USV, your reliable healthcare partner.
Welcome to this show on Halt the Heart Attack. Today we are going to talk about living with the heart attack. And here you have experts from across the country. India, as you know, has become the hub of heart attacks and heart ailments. Certainly not something which can feel proud about. We at the Cardiological Society, we are taking great efforts to control this growth of heart ailments. However, there are limitations, and let's share some of the facts today which are going to help us get to the root of the cause and reduce the overall incidence across the country. Also, it's going to tell us how good you can come out of a heart problem once you have suffered a heart attack. And on this front, I have with me a panel of specialists. To my left, Dr. Shanmukha Sundaram, he comes from Chennai. He's the consultant cardiologist at the Bildroth Hospital, and more importantly, he's the convener of the preventive cardiology component of the Cardiological Society of India. Next to him is Dr. Amit Vora. He comes from Mumbai. He deals with lightnings which strike the heart. He's actually the rhythm specialist, as we call it, and he happens to be the president of the Indian Heart Rhythm Society. Next to him is Dr. B.K. Shastri. He comes from Care Hospital, Hyderabad, intervention cardiologist who has huge experience. And next to him is Dr. Nagaraj Desai. He comes from Mysore. He's the professor and head of department of JSS Medical College and Hospital. So Dr. Shanmukha Sundaram, when a patient comes to you and you say, oh, there could be a possibility of a heart problem, and you know there are different kind of reactions that the patient says. Everybody wants to believe that disease is not for him, ailment is not for him. So how do you go around and sort of tell them, yes, be careful?
There are multiple ways in which the patient can react to this news. The most common thing that a patient develops is denial or refusal. All of them feel that I don't have a heart problem, I can't develop a heart problem because my habits are clean, I don't have high BP, and things like that. Denial is a negative thing, because if you deny the fact, you are likely to get into problems, because you are not going to take the appropriate treatment if you deny the diagnosis. The second emotional response which the patient gets is the anxiety or the fear. It's natural for anyone to get anxious or get worried about the ailment, but if you are constantly and excessively worried, it adds to the heart problem by increasing the heart rate and blood pressure. The third way in which the patient reacts is by getting depressed, the sadness, remaining alone, getting worried all the time about the illness, developing some negative emotions. It is actually the worst kind of reaction to the news of getting a heart problem.
And I'm sure, Dr. Vora, you know, practicing in Mumbai, you face a very intelligent class of people. There, they are net savvy, they already know so many things about the heart. So even if you're suspecting a little bit, you just want to exclude a few things from a patient's coronary point of view. How do you go around and tell them what investigations are required?
So I think we need to clarify certain misconceptions and misunderstandings patients have for these varied responses which we see. One of the important things which I see is that patients say that, you know, I have had no symptoms, I have no complaints, but yet I have been told that I have hypertension or diabetes or high cholesterol, or even some people all of a sudden develop an acute heart attack. Now, it is important to realize that hypertension, diabetes, dyslipidemia, all of them been labeled as a silent killer. So often they have no complaints whatsoever, and suddenly they may crop up. So, it is important to realize that these are important risk factors which needs to be controlled very well. Well, friends, if you have heart disease, it is very heartening in the current era to realize that modern medicine can very effectively stabilize your heart disease and prevent further complications, and you can really lead a normal life.
And the bigger worry, Dr. Shastri, is one's heart problem. You know, they are going to be on medications. How long? Lifelong?
Patients have to understand they have most often they have to take the medication lifelong. It is better to accept it rather than resent it. If you understand the rationale why they have to take medicines lifelong, it becomes easy for them. The one reason we give medication to them lifelong is to prevent a second attack. Somebody who is prone for heart attack tends to get another attack. So, we want to prevent that and prevent further harm. The second reason we give what we call tertiary prevention or prevent the complications. Whenever heart attack occurs, some damage would have occurred. You want to prevent the further complications. And you should know most often these patients have associated diabetes, hypertension, high cholesterol and tendency to close their blood vessels. So, we give variety of medicines to prevent further complications. And in our practice, we realize the most common reason for the patient to come with second attack is they have stopped medicines. So, it should be understood by everybody that by taking medicines lifelong forever, they can prevent further attacks and even further strokes.
What do you feel, Dr. Nagaraj, in 2017 after a heart attack, can one get back to a normal life?
Yes, indeed. Most of the principles of modern therapies, especially in the management of heart attack, is to bring back the patient to the social fold he lived in, professional fold he lived in, and he would like to be rehabilitated, as we call it, to the original vocation that the patient was enjoying. In fact, the modern technologies is able to bring back the patient to the original job that he was doing in the past. However, having said that, heart attack is a big basket of varied syndromes. In other words, a person may have a mild problem, person may have a very severe and serious problem. Depending upon the situation, the doctor will have to tailor the patient's total management in terms of the rehabilitation. In general, I would say that after a heart attack, the patient can aspire for the original way in which he was living. That is the purpose of this particular management style.
On this front, I remember one of my patients who climbed to 23,000 feet in the Himalayas. He had 6 months back a heart attack, very effectively treated. We did an angioplasty. 3 months later, he got into an exercise program, used to train himself, started climbing hills around the 4th month. And in 6 months, he climbed to 23,000 feet, came down to around 18,000 feet when he got the first cell connectivity and phoned me from there saying that, "Doc, I'm here at 18,000 feet.
Yes.
And it's a thing of great pride for everybody, the way the family group around him helped him, the doctors, the way they treated him. I think it's a real tribute to modern medicine that yes, after heart attack, you can get back to a functional normalcy. And most of them, Dr. Vora, would need blood thinners, as we call them. We already know aspirin. Aspirin, everybody knows, is taken for heart attack. We use actually a baby aspirin, and this baby aspirin is also good enough as a blood thinner. But heart disease is such that you need a little bit beyond aspirin.
So, blood thinners are very important because essentially they prevent the formation of the clot, which is the root cause of the problem for developing a heart attack. So, blood thinners are prescribed to patients who have already had a heart attack or who have undergone angioplasty and stent implantation or even a bypass graft surgery, and that is what we call a secondary prevention to prevent a second heart attack. It may also be prescribed to people who have multiple risk factors, but yet not developed any heart attack as such, as a primary preventive measure also. Aspirin, as you said, and clopidogrel, these are the common blood thinners which are given to these patients. And yes, these medicines are required lifelong. Often the question is asked that I have already undergone treatment with angioplasty and stent and a bypass surgery. Why do I need blood thinners lifelong? Well, to keep that stent patent and prevent a clot formation in the stent, you need the blood thinners. to prevent development of blockage distal to the bypass graft, you need the blood thinners. And also there are these minor blockages which can get complicated, resulting into a acute heart attack, which also needs prevention with these blood thinners.
So, Dr. Shastri, when patient is thinking so much about just tablets, when we advise them, yes, you have a blockage and you need an angioplasty, do they start wondering that, yes, doctors are advising stent to everybody, or how do you explain to them who needs and who can get away without a stent?
Well, stents are required in most of the patients, not all patients obviously. When the patient develops acute heart attack, that is the time he must have a stent. That is the time when it prevents death and saves life. There is unlimited data on that. So, when somebody goes to hospital with acute heart attack and doctor advises angioplasty stent, rather than taking multiple consultations, phone calls and all, immediately they should go for stent implantation. The second situation, when there is a imminent heart attack, like patient is having a warning symptoms for heart attack, after angiography the cardiologist may decide for stent, that is another sound indication. And third thing is, when somebody is having chest pain on exertion in day to day living, when the blood flow is compromised in the blood vessels, to reduce the narrowing and to free the passage of the blood, stents may be advised. When the patient is stable, he has enough time. So, in such situations sometimes surgery may also be an option. In such situations, the cardiologist and the surgeon and the patient family can sit together and decide.
We have ways, remedies, interventions like angioplasty, which can put you back to normalcy, put you back professionally where you were. However, if something is prescribed, don't forget, it may be blood thinners for lifeline, or maybe a stent which is going to be for you, for your health, again for your lifetime. And we come back soon after a little break. Stay tuned, we have a lot more to offer.
The homes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, at USV, you before we, at
USV, your reliable healthcare partner.
The homes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, at USV, you before we, at USV.
USV, your reliable healthcare partner.
Welcome back to this show, Preventing Heart Issues, and we have the expert panel which has been taking you through heart attack, how to halt them and how to get back to normalcy. Dr. Shanmugasundaram, we have heard some people who need stent. Some people are also worried that they will have to take lifetime medications and so on. So how do you rate the other therapies compared to modern medicines?
I mean, actually, there are two ways. One is complementary therapy, another one is alternative therapy. But none of them could ever replace what the modern medicine offers. We have robust scientific backup on what the modern medicine can provide in the form of drugs or the devices or in the form of procedures like surgery or angioplasty. With this amount of scientific data, we are very sure that the drugs or the procedure are absolutely safe for you and they are very effective. But unfortunately, the so-called complementary therapies and alternative therapies do not have enough scientific backing to support their claims.
So, Dr. Nagaraj, we have everybody participating in the well-being of the patient, and we know the role of the family is going to be very important. So how do you rate the importance of all these caretakers around a heart attack patient?
Patient's family plays a pivotal role in the total management of patient. It is not just about the medication availability, taking the patient to the doctors, making sure that the patient is adhering to the lifestyle modifications like abstinence from smoking, regular exercise, and be part of the family network. In other words, the spouse, the children, the parents, and everybody plays an important role. In fact, what I have seen in my practice is nearly not just the patient, but also the family also get adhered to the modern way of lifestyle management, so that the family also get benefit out of helping the patient to get better. The patients who received extensive family support, they did very well on follow-up. I strongly believe in that. The family support is an important component of the total therapy.
And Dr. Vora, sometimes the family would ask you, yes, we have gone through so much anxiety during the acute phase, now we are home, my husband is back at work and so on. So the wife wants to know whether somebody can be cured completely from a heart problem once he has suffered a heart attack.
Unfortunately, heart attack and heart disease cannot be cured completely. Heart diseases can be stabilized very well. You can prevent the development of a heart attack by all your appropriate lifestyle measures and medications, but the root cause of the problem is the blockages, which is because of a atherosclerotic process where cholesterol deposition happens in the blood vessels of these coronary arteries, and that cannot be reversed because that's a part of an aging process. It is linked to advancing age that the atherosclerotic process keeps on happening. But yes, you can prevent the progression, you can slow down the progression of atherosclerosis to an extent. Even there can be a regression of the process, but you cannot eliminate it completely, and therefore, it will be very essential that you take lifelong measures in terms of lifestyle modifications, appropriate medications, and regular medical follow-up checks.
And Dr. Shastri, do you feel for the same reason the patient should come on regular follow-ups to you? How often do you call them?
Of course, the patient has to come for regular follow-up. How frequently they come depends on their clinical condition. Somebody is unstable, uncontrolled symptoms, uncontrolled blood pressure, and for drug monitoring. Initial stages, some people may have to come frequently, maybe once in a week, 10 days. But once the patient stabilizes, the patient can come once in 3 months. This is essentially to see whether they are compliant with the medication, we are compliant with the lifestyle changes, and if the patient has developed any new symptoms, any new advances have taken place in the medical knowledge that can be beneficial to the patient, all these things can be covered. So, the reasonable time for a stable patient to consult a doctor should be about 3 to 6 months.
Dr. Shanmukha Sundaram, are there any periodic checks that you advise the patients, like say pathology, and then we have so many evaluations in cardiology like stress test, stress thallium, and coronary angio? Do we need to do them again?
I think most important aspect is visiting the doctor on a periodical basis, because it gives an opportunity for the treating physician to know whether the treatment offered is effective and safe for you. It will help him to recognize any side effect of the medicine, rectify that then and there. As far as investigations are concerned, once in 2-3 months, I think you need to have a physical examination and an electrocardiogram. They are very important. Even in the absence of symptoms, it has to be done. At least once in 6 months, I would rather prefer your blood profile, which includes your glucose level, liver functions, kidney functions, and cholesterol, has to be done once in 6 months. As far as the other investigations like echocardiography, treadmill testing, have to be done as and when required. I think the treating physician would be the right person to decide when it has to be done.
And Dr. Nagaraj, what kind of exercise prescription you give them? I mean, once he's returning home, reasonably healthy, and heart has been conserved.
Yeah. In fact, exercise prescription is part of the total cardiac rehabilitation program we talk of. In fact, when the patient gets discharged from the hospital, by then he already would have achieved certain activities levels, like going short walks within the hospital corridors, going one stair up and down, so that he can be confident when he goes back home along with the patient's spouse. There can be two varieties of exercises called dynamic exercises or isometric exercises. The dynamic exercise, simple examples can be walking, speed walking, the cycling, and also swimming. These are good exercises for the heart in terms of capacity building, in terms of rehabilitation. Whereas isometric exercises, like for example, weight-bearing exercises that one goes to gym and tries to do the so-called weight-bearing exercises, not very safe, especially the patient is recovering from a heart attack, because these exercises cause an increase in the heart rate, not good for the patient, increase in the blood pressure, especially systolic blood pressure, not good for the heart patients. In other words, when the prescription for exercise is given, it has to be done under supervision, especially if the patient is planning to do some kind of advanced exercise programs. It better be done under supervision for the first time.
Yeah.
In other words, there cannot be a single one solution fits all. It has to be taken care of depending upon what is the residual problem in the heart patient.
Finally, Dr. Shanmugasundaram, we have diet is a very important issue. This is good, that is good. So many times the media gives all kind of reports, there are publications. So how do you find your way and give the correct advice to the patient?
Diet is the cornerstone of managing people with heart diseases. I will probably start off saying that one should eat less to the requirement of the body needs. And appropriate meal timings are important. Skipping meal is bad, and eating heavily at nights when your metabolism slows down is really very bad. Coming to the quality of food, we all know that fat is bad, but not all fats. There are certain type of fats which are very useful, actually cardioprotective, and there are certain oils which are safe, and you need to use a combination rather than one particular type of fat or oil. And remember that it is not the fat that alone is important. Eating a lot of carbohydrate is also equally bad. It allows the body to get converted into fat and get stored. So eating carbohydrates to your required level is very, very important. I would insist on eating a lot of vegetables and fruits, particularly with the different colors, something with green, something with yellow skin, some with orange skin. Eat a variety of fruits and vegetables in large quantity. Even if you are not a high blood pressure individual, you need to restrict salt. Even if you are not a diabetic individual, you need to cut down on sugar and sweets. And there are good cooking methods, safe cooking methods, which one should adopt. Instead of deep frying, stir frying, baking, grilling, these are the better methods.
We all feel proud that we are Indians, but Indians, we carry genetically some kind of predisposition which makes us susceptible to heart problems at a younger age. In fact, in India, heart attack strikes 10 to 15 years younger than what people get in Western world. So our Indians are 45, 50 when they get into heart trouble. So we have a lot of responsibility to carry this engine to another 20, 30 years healthily and effectively. So we have ways to do it. If a stent is required, go for it. If a bypass surgery is required, you go for it. But bottom line to everything is to feel confident, get into some kind of exercise program, eat correct food, be healthy, socially be active, keep smiling. And all these will help you to stay away from a repeat problem. We all heard that a repeat happening for a heart attack patient can be an eventuality. Somewhere down the line, after 10 years, 15 years, 20 years, the heart problem can come back to you. We have to prevent it, we have to avoid it. And every little step that we take is going to be crucially important in keeping you healthy. But always believe that one heart episode is no write-off. You can come back, you can be fully functional, and you can go to a level, as I told you, 23,000 feet up in the Himalayas. Yes, that is possible. So believe in yourself, believe in the modern treatment, and of course, if you take good care, we are going to be where you are in a very, very healthy fashion.